My name is Craig Johnson. I'm a physician assistant, and my specialty is geriatric medicine. Primary care, but focused in geriatrics. Yeah, I made that decision actually a little later than most. I was already finished undergrad. My undergrad was in psychology, and I was interested in some allied health fields. I was looking into physical therapy, occupational therapy, and then when I was actually doing a volunteer experience in occupational therapy, I met a physician assistant who I thought was a doctor, and started asking questions about that profession, and was fascinated that you could practice medicine without going through the course load or the years to become a physician, which kind of stimulated my interest to pursue physician assistant studies. Yeah, geriatrics has always been my thing. Since I was about 12 years old, I started doing landscaping for an elderly couple on weekends, and then as they aged, I started doing more home care services for them, more assisting with dishes and grocery shopping, doctor's appointments, and as they failed, I started doing more personal care and hygiene, and just really connected with them and their friends, and kind of knew at that time that that was my area of focus, and that's what I needed to do in some capacity. So I'm from Reisterstown, Maryland, Baltimore County, and my parents retired here back about 12 years ago, and when my wife and I started our own family, we were living in Baltimore City, and we decided we wanted to be close to the grandparents, so we packed up and moved to the Eastern Shore, and have been here for 10 years. The most rewarding experiences are often the more challenging ones that come along with geriatrics. In a sense, it's not always straightforward of what to do, the right and the wrong. It's a lot of personal beliefs, a lot of assessing the big picture and which direction patients and their families want to pursue as far as treatment in certain circumstances that you can't always find the answers in the books. So you have to really combine medicine with patients' philosophies and their families' wishes, and try to help them navigate what the best path is for each individual. And that's different for every patient. You know, I think what I can assure my patients is I won't always have the answers, but I will assure them that I will always listen. And if I can't come up with the answer, I'll be sure to send them somewhere that we can find the answers. But I think most important is that I will listen, and I will establish a relationship, and I believe in a partnership as opposed to a dictatorship. So I find my role is to educate patients on healthcare, and give a professional opinion on what I think is the right direction, and I incorporate patients' wishes in coming up with their decisions based on what I inform them and what patients nowadays find online and in many other avenues. So it's a partnership and not a dictatorship, and that's kind of what I'm going to provide them.